The health costs of worsening air quality are adding up. In November 2025, hundreds of people gathered at India Gate in New Delhi, wearing masks and carrying signs that read, "I miss breathing." The city's PM 2.5 levels had surged into the hazardous range, with daily averages approaching 460 micrograms per cubic meter. Hospitals reported rising admissions for asthma and cardiac events. Schools closed. The government urged people to stay inside. It was a dramatic moment, but it was not an isolated one. The 2025 IQAir World Air Quality Report analyzed PM 2.5 data from 9,446 cities across 143 countries and found that only 14% of global cities met the WHO's annual PM 2.5 guideline, down from 17% the year before. A wildfire season that released approximately 1,380 megatons of carbon from biomass burning across Europe and Canada alone drove much of that decline. The health and financial consequences attached to those numbers are substantial. What PM 2.5 does to the body. PM 2.5 particles are small enough to bypass the nose and throat entirely, penetrating deep into the lungs and entering the bloodstream. Air pollution from fine particulate matter caused 6.4 million premature deaths globally in 2019 alone, according to the Global Burden of Disease study. By 2023, total air pollution mortality had risen to 7.9 million deaths annually, including more than 610,000 infants under 1 year old who are especially vulnerable to respiratory infection. PM 2.5 promotes the development of cardiovascular risk factors, including hypertension and atherosclerosis, and is associated with an increased risk of myocardial infarction, stroke, heart failure, and arrhythmias. Operating through increased oxidative stress, inflammatory pathways, and stimulation of the autonomic nervous system. On the respiratory side, research across European countries has found that respiratory mortality rises measurably with each 10 microgram per cubic meter increase in fine particulate matter, and that long-term PM 2.5 exposure reduced average life expectancy across EU populations by roughly 8.6 months. When daily PM 2.5 increases by 10 micrograms per cubic meter, hospital admission rates for respiratory conditions rise by approximately 8%. Children carry a particular burden. The IQAir report notes that respiratory damage sustained during developmental years is frequently irreversible. In the South Durban Industrial Basin in South Africa, epidemiological research found asthma rates exceeding 50% among school children living near the region's heavily industrialized port. The brain connection. One of the most significant developments in air pollution research over the past 2 years is the strength of evidence linking PM 2.5 to cognitive decline and dementia. The 2024 Lancet Commission on Dementia identified air pollution as one of 14 modifiable risk factors for the disease, estimating it accounts for approximately 3% of global dementia cases, or roughly 1.65 million people. An NIH-funded study tracking more than 27,000 adults over a decade estimated that as many as 188,000 cases of dementia per year in the United States may be attributable to PM 2.5 exposure alone. A 2025 Lancet Healthy Longevity study using data from the 1946 British birth cohort found that for every interquartile range increase in nitrogen dioxide exposure between ages 45 and 69, cognitive processing speed declined measurably at age 69. The research found that exposure to all measured pollutants was associated with poorer cognitive performance compared to no exposure. Air pollution-related dementia kills over 625,000 people per year globally. The economic impact of dementia alone is estimated at over $1 trillion annually, driven by the daily care dependency the disease creates. The economic weight. The World Bank estimates that air pollution costs the U.S. economy over $790 billion per year, roughly 5% of GDP, in economic welfare losses. Globally, the cost of health damages from air pollution reaches $8.1 trillion annually, equivalent to 6.1% of global GDP. The EPA has previously estimated that every dollar invested in cleaning the air returns between $30 and $90 in improved health and economic productivity. That ratio is now at risk as those benefit calculations have been removed from regulatory assessments at the federal level. making it harder for policymakers to weigh the true cost of inaction. The conditions driving poor air quality in 2025 are not easing. Wildfire seasons are intensifying, AI data centers are emerging as a new PM 2.5 source, and the proportion of global cities meeting basic air quality standards is declining. The health system costs that follow those trends will not be theoretical. You've been listening to Sustainability Soundbites by Environment and Energy Leader. For partnership opportunities, please reach out to our team.